Dr. Jenny Brennecke here, licensed physical therapist, going to walk you through a 15-minute interactive mobility session where all you need is your body, a wall, and a 12 to 18-inch box. If you're looking for a structured full body mobility program, head to the Revitalize Recovery app and use code YouTube10. I'm giving away a 10% discount to all purchases 1 week after posting this. It's 5 days a week, 15 30-minute sessions broken up into an upper, lower, and full body sessions designed to support your workouts or as a standalone recovery session. Basically, all the tools you need to stay accountable for your recovery. So let's get started. First, we're going to start out with a full spinal flexion extension. It's going to be a child's pose to a cobra. So we're going to get here, start first in our child's pose position, sitting back into those heels. I want you to take a big deep breath here. So in through the nose, big exhale out through the mouth. Just trying to sink it down each a little bit further. Okay, and then we're going to go to our cobra position. Again here, taking a big deep breath, trying to drop those hips down to the ground. Inhale, full exhale, and we're just going to go back and forth between those two positions. So again, big inhale when we fully sit back. Big exhale. Trying to sink a little bit further every single deep breath. Okay, back to that cobra. Into our child's pose. And again. Fully let your spine extend back, even bring your head with it. This next one, I want us to bring our hands out to the side. So you're gonna bring your hands out a little bit laterally so we can stretch a little bit more to the side. Sitting our hips down again. Big inhale, full exhale. When you bring your hips, you're almost trying to bring your hips back and across to stretch that lateral side. Okay, big inhale, big as exhale. Then I want you to walk your hands over to the other side. We do a big inhale here, big exhale. Just really stretching that lateral lat and those shoulder musculature, and then we're gonna go back to that side kind of cobra. So drip those hips out, stretch along that lateral side there. Again, big inhale, big exhale. Walk it back. Last one, bring our hands to that side. Big inhale, big exhale. Stood it back. And last one, back up into that cobra. Perfect. Okay, so our next one, we're gonna get our 18-inch box and we're gonna go into our couch stretch. So for our couch stretch, we're gonna have our foot up onto this back box and we're gonna be in this tall kneeling position. What we're doing is we're going to a posterior tilt. So we're thinking about tucking our pelvis underneath by squeezing this underneath glute here. Give me like a 5-7 second contraction, relax, then reset again. Squeeze that glute, tuck underneath. The biggest mistake on here is people just want to really lunge forward, but the job of that glute or the job of that hip flexor is to anterior tilt your pelvis. So we want to go into a posterior tilt. Okay, it's a PNF contract relax technique. Just doing a 5-7 second squeeze, then relax, reset again, squeeze and tuck that pelvis underneath. We can also add a little bit of a fascial stretch. So if we kind of reset that pelvis, tuck underneath, you can kind of reach back to that box, do a big reach back and across above your body. Okay, 5-7 second squeeze again there. Relax, reset, hold that pelvis underneath, tuck that glute. As we exhale, big reach back. Okay, and again, big inhale, exhale, as we pull back. Do 2 more on this side and then we'll switch to the other side. And again, big inhale, exhale, and pull back. Good. Should feel this all along your hip flexor, also quad. Last one here, squeeze as we reach back. Okay, we're gonna switch sides. We're gonna do the exact same thing on the opposite side. Get there, tuck that pelvis underneath. We can do a couple where we just get that mind muscle control of that PNF and really contract that glute. First, just show your mind and body. That's the only muscle engaging as we get the opposite muscle of those hip flexor stretching. Okay, we'll add those reaches, squeeze that glute, reach back and across. And again, tuck underneath, squeeze that glute, reach back and across. And again. When you do these reaches, you can almost imagine a little bit of trying to bring those hips forward as you come back, but not too extreme, because like I said, the main motion here is above that posterior tilt. Okay, we'll do one more. For good measure. Perfect. Okay, we can get rid of our box here. So next is our scorpion lift off. So we're gonna lay on our stomach with our hands in a Y position. We're gonna go into a scorpion where we're rotating our body to bring this heel to the opposite ground. And then when we come back, we're using this arm here to go into a thoracic rotation. You can kind of use your eyes on your hand to follow your body. Exhale, sit it back. Okay, let's shake it out and let's switch sides. So we'll go on this side, forearms again, sit it back as we rotate that foot up to the ceiling. Okay, if this is too much for your knees to be on your knees like this, you can also do it on a box. Obviously, we just wouldn't get the forearms involved, which is totally okay. You just kind of go wherever your body needs to go and progress from when you need to, okay? One more here, there, and sit it back. Perfect. Okay, so next we're gonna do a 90-90 hip flow. So we're gonna get into our 90-90 position, okay? So what we're gonna do is we're gonna first bring our body over our hands, so our hands over our knee. A little bit slight lean forward as we keep our spine in this position. We're gonna bring this back leg up, okay? You're gonna give me 3 of these. So we're gonna bring that back leg up. As you're keeping that spine nice and straight. Then you're gonna bring your body back. We're gonna go the opposite motion, where now you bring your knee up. So you're gonna bring your knee up. 1, 2, and 3. And then we're squeezing our glutes. So we're squeezing this back glute. We're gonna go 3-second count. So squeeze, can almost hip thrust your hips forward. 2, 3, and then relax, go again, squeeze those glutes. 1, 2, 3, and last one, squeeze. 1, 2, 3. While keeping your feet in the same position, we're just gonna rotate our body over the opposite direction. I'll move my body back so I'm here. Now I bring in those hands to the opposite side, keep that body forward, reach that back up, 3 reps. Try not to bring your body with you. It's really just your spine stays stable, and we're just trying to get the internal rotation of that hip. Okay, then walk it back. We're bringing this, now we got external rotation, so we're just trying to keep that foot down to the ground, bring that knee up to the ceiling. In 1 more rep. And now we're squeezing that back glute. So squeeze that back glute, thrust those hip flexors forward. So think like a stretch along those adductors, along with those hip flexors. And then again here, squeeze that glute, tuck underneath. And again, squeeze and tuck. Okay, keeping your feet in that same position. Rotate back. And we got another one more each side. Rotate up. 1, 2. You should think about really squeezing this posterior glute when you're in that. Rock it back. Anterior tilt as much as you possibly can to that posterior tilt. Okay. You can also sometimes feel when you go into that posterior tilt, it actually stretches a little bit more of those structures back here, a little into that thoracolumbar fascia. So just depending on where your body sits naturally, if we sit in a more anterior tilt, then you might want to go a little bit more posterior tilt. If your body sits in a more posterior tilt, you might want to focus a little more anterior tilt. And thinking about those muscles that cause that rotation in both directions can be strengthened as well. Okay. Last one here, full anterior, full posterior. Okay, next up, we're gonna go to some robots here. So with our robots, we're gonna be on our wall. We're gonna have our elbows up high. We're gonna go from all the way internal rotation on this arm to then external rotation the opposite way. We're just gonna go back and forth between the two. Okay, all the way internal rotation, all the way back as you can the other way. Goal here is you wanna keep those elbows high as you start going along. Your elbows might start to come down. Keep those elbows high the entire time. As well as you want to think about those wrists. Keep those wrists flat and you're not reaching back with those wrists to try to cheat that motion. Make sure it's all coming from that shoulder and just back and forth. Okay, we got about 30 more seconds. Back and forth. Trying to reach each one, working on that internal and external rotation of the shoulder. Good, 15 more seconds. Good. 5, 3, 2, 1, and relax. Okay, our next one is gonna be our seated butterflies. So with our seated butterflies, we're gonna start with our head down, our hands interlocked between our head. We're gonna start with just in this poor posture. We're exhaling as we extend up into a good posture. Okay, bring those elbows back as you can, tall posture. Big inhale when we come down, and then exhale when we come up. Big exhale, nice and tall. And again, big inhale coming down. Exhale and come out of it. And again, big inhale. Exhale. Last 2. Big inhale. Big exhale. And last one. Last one, exhale. Great job on completing this full body mobility session. If you guys like this structure, be sure to head to that Rise Recovery app, check out that full body mobility program. And remember, I'm giving away that 10% discount code by using YouTube10. This program is designed to make you move better, feel better, recover faster, and so keep making time for your long-term health and your mobility. Thanks for joining me today. Stay consistent, stay strong, and I'll see you guys on the next one.